So common problems in dentistry are pretty straightforward. Well, the most common ones are cavities and gum disease, right? But beyond that, the biggest epidemic that I find in dentistry is actually dry mouth. Dry mouth is so prevalent because, as evolution has occurred, our sinuses have shrunk, so we're breathing more through their mouth, creating a dry environment, which leads to cavities, gum disease, acid reflux, and all sorts of other problems systemically. Now, that dry mouth is also happening because of braces. If your child had braces, it doesn't allow the sinus to grow, so people end up needing air, right? It's the one thing we can't live without. So we end up breathing through the mouth, which creates, again, that just said dry mouth, and that ends up being a real huge concern. Also, patients on different medications end up having dry mouth. So that is the biggest epidemic that I really witness, and it actually doesn't get as much attention as it should. Mostly people or dentistry is always talking about cavities and gum disease, and it's pretty basic stuff, but they're not going into whole body health, and they're not going into airway, and they're really not looking at saliva and the types of bacteria that grow from a dry environment and what detrimental effects that it has on the overall health. So those are some things that I feel like are, like dental epidemics. The next thing I would say is a big dental epidemic is vitamin D deficiencies. We as a society have started to be on our phones, be indoors. We're not spending as much time on the outside, so we're not getting as much vitamin D. Now, vitamin D is important for your teeth because it helps prevent cavities, but more importantly, vitamin D is also a hormone that helps regulate your entire body, and that is a huge concern because, like for example, I'm sitting here and the sun is here behind me. It's beautiful, but I'm not really absorbing the vitamin D because this window has a tint on it. It actually prevents UVB from coming in, and that's what our bodies actually need in order to convert cholesterol into vitamin D. So that is a huge epidemic that I see, and what I see in the mouth is their pulp horns are really big, they're decalcified teeth, also more cavities, gum disease, and a lot of other issues like ADHD, anxiety, gut microflora is off. These are the things that I hear from patients all the time. So I would say dentistry really needs to look at these, really look at the whole body health, and really look at how interconnected we are and how we can better serve our patients.